Hi, good afternoon, and thank you for joining us here for another segment of Wildlife Wednesday. My name's Rachel, and today I'm going to be going down to the hospital to observe some of our medical staff performing surgery on a black racer. At Crow, we rescue and rehabilitate more than 5,000 animals a year, and quite a few of them are admitted as a result of a traumatic injury. Now, the way in which our medical staff repairs these injuries is through a combination of methods ranging from intensive care and medical support as well as surgeries. On average, Crow's medical staff performs 5 to 7 surgeries per week. These can range from either hook and line removals, soft tissue surgeries, or even orthopedic repair, where we're fixing broken bones. Now, on this week's segment of Wildlife Wednesday, we're going to be observing the staff performing a soft tissue surgery on a black racer patient that was admitted early this week from being entangled in a type of netting. And we're going to be meeting one of Crow's veterinary interns, Dr. Sasha Troiano, for more details.
Hi, I'm Dr. Troiano. I'm one of the interns at Crow. Thanks for joining us today for this week's Wildlife Wednesday. We're going to be talking about a black racer snake that we got in yesterday, October 25th. And this snake was caught in some of the wildlife netting. It's also known as anti-bird netting. And he has some pretty significant wounds and abrasions over the top part of his body closer to his head. So unfortunately here we see a lot of animals present with injuries and sickness related to human events and human interactions. So the wildlife netting people use for a variety of reasons. They use it to protect crops. Sometimes they use it to prevent birds from flying into certain areas, and people cover ponds with it. But it actually has significant negative effects on our wildlife, specifically our snakes, because they can get trapped in it, and then they get all sorts of soft tissue wounds and abrasions over their body. And the issue with when they get these sorts of wounds is they can have constriction injuries or the loss of blood flow to areas of their body that then subsequently will die. Or if they just have a big abrasion or a superficial wound that opens them up for infection, which can then take over their body and can also be lethal. So a variety of different injuries that can be caused by this netting, which is obviously avoidable if we don't put it out in the environment. So when we have superficial abrasions, depending on the size of the abrasion and the location of the wound, sometimes they can heal in on their own. Sometimes they need bandaging until it heals on its own. Sometimes we do primary closure, where we actually suture the wound closed. And sometimes you even put a graft or a donor piece of skin over the wound to help it heal in until it's fully healed. So for most of our patients, when they come in, we take Xrays or radiographs of them to make sure we're not missing any internal injuries or musculoskeletal injuries or fractures. So for this snake, we took Xrays of him, and you can see here some of this weirdness is a bandage that he already had on the wounds. But fortunately, we didn't see any fractures. He can move his entire body. He can urinate and defecate normally. So really the issue with this snake is two sizable wounds close to his head with significant muscle exposure. So the risk is that if that dries out, then that muscle is going to die and not be viable anymore. So for him yesterday when he came in, we put a honey bandage on. So honey has a lot of medical properties. It's antibacterial. It can help promote growth and oxidation. And so we like it when we have dirty wounds that we need to clean up. So when we looked at the wounds today, they actually look better than they did yesterday. We helped keep them moist so that they didn't dry out overnight. And the plan for him today is the wound that's closer to his head, we're going to do the primary closure. So we're going to suture it closed because the skin's going to come together nicely. And the bigger wound that's a little further back than that, we're going to do a combination of suturing closed the areas that we can. And then we're also going to place a bandage called a duoderm bandage. So it's a man-made material that helps promote growth and helps promote the secretions and healing underneath the bandage while it's on. But you actually suture it to the skin and leave it on for at least a week in reptiles to help healing underneath it. For surgical procedures, we have our patients anesthetized, and so prior to anesthesia, there's a couple different ways that we can medicate them. So we can use intramuscular injections of sedation to help calm them down. Sometimes you can use intravenous injection For this snake, we gave him intramuscular injections because we were unable to attain venous access yesterday when we tried to get a blood sample, and it's less stress just to give some intramuscular sedation. So once he's sedate enough, then ideally we'll be able to open his mouth and intubate him. And once he's intubated, then we can hook him up to gas anesthesia and maintain him on the gas for the duration of the procedure. So for this snake, because we're closing a smaller wound with primary closure and then the bigger wound with the primary closure and the duoderm bandage combination, once he is fully sedated and anesthetized, the procedure itself shouldn't take too long, probably about 15 to 20 minutes. It's really just how long it takes to flush, clean those wounds, and suture them closed. So it'll be pretty quick, and then they tend to recover fairly quickly from the gas anesthesia as well once they breathe it off. So hopefully all in all, it'll be less than an hour.
Thank you, Dr. Troiano, for sharing all of that wonderful information with our audiences. Now, as a couple of announcements, we will be taking a break from our Wildlife Wednesday segments to be focusing on our Taste of the Islands fundraiser, which starts this Sunday, November 1st, on Sanibel and Captiva Islands. This is Crow's largest fundraiser of the year, and it helps us provide medical and supportive care for the more than 5,000 patients that we admit annually. If you are interested in supporting Crow, you can purchase passports, vote for your favorite restaurant, sample some of the delectable goodies that our islands have to offer. So visit Crow's website for more details.
Join Fox 4 for the 39th Taste of the Islands, benefiting the Clinic for the Rehabilitation of Wildlife, reimagined and all November long. All you need is a taste passport, available at any of these locations. Proceeds ensure Crow's continued success, providing the highest quality care and treatment of injured, ill, and orphaned wildlife through state-of-the-art veterinary care. It's the 39th Taste of the Islands, all November. Visit fox4now.com/crow for details.